have better therapies in the recurrent setting, patients are living longer. So the prevalence, in the number of patients just walking around the United States living with ovarian cancer right now has exceeded 200,000 cases. And that happened in about 2017. So that's an interesting kind of epidemiologic shift that drives a lot of the drug development that's happening right now in the recurrent setting, because there's so many more patients living longer and in need of more effective therapies. Ovarian cancer, while we are just like other cancers seeing, I think, an increasing number of younger patients, premenopausal patients presenting with high-grade serous ovarian cancer, even outside of BRCA or other germline risk factors, we can't quite explain that. It does still remain predominantly a disease of older patients, postmenopausal patients, as are most cancers. The longer you live, the higher the risk is. And you can see that here as well. There is also some difference by race and or ethnicity, with higher rates seen in non-Hispanic white patients, as you can see here, and a little bit lower incidence in like Black patients or Hispanic patients, but not that much lower. And so the risk is fairly even, really, to generalize across all ethnicities. The current regulatory standard for definition of platinum-resistant ovarian cancer is still defined by a time interval from the last platinum being less than 6 months. And that remains the regulatory standard, although we're working on this, because it doesn't take into account the things we take care of that we consider in clinic. The patient in front of you, the biologic heterogeneity of her disease, the biomarkers her tumor may have. Did the last time she got platinum, and did the tumor melt away and then it grew back at 5.9 months, or was the tumor stable and kind of smoldered along for 5 months? Those are very different tumors, and you're going to make different decisions, not entirely based on this dichotomization greater than or less than 6 months. And so clinically, we know this, but from a clinical trial development standpoint, we're still kind of locked in, unfortunately, to this definition.